Welcome to our presentation with UTIHI in conjunction with Access Alliance Multicultural Health and Community Services. It is a process evaluation of a community health needs assessment for the Rockcliffe-Smythe neighborhood, done by Laura Tang, Bukama Muntu, and Sandy Johnson. Access Alliance Multicultural Health and Community Services is a nonprofit, community-based organization and community health center. It has 5 focus areas: primary care, illness prevention, health promotion, community capacity building, and service integration. It serves clients at 4 different locations: a point on Danforth, a point on Jane, the college site, and Barrington site. The Rockcliffe-Smythe neighborhood is served by Access Point on Jane. It is a primary neighborhood for Toronto. It is considered a priority neighborhood for Toronto because it has a large immigrant and refugee population. The population is 22,246 people, with 3 languages spoken: English, Portuguese, and Spanish. Thus, the ultimate goal of Access Alliance for RSN is to improve the quality of life of the residents of RSN so that it can achieve health and well-being with dignity. So how does Access Alliance inform evidence-based program planning to improve community service delivery? 2 things: conducting a community health needs assessment and conducting a process evaluation of that CHNA. 1. What is a community health needs assessment? A quantitative resident survey was given to the community members, and qualitative focus groups were held to identify the assets, needs, and service priorities of community residents and service users at RSN. 2. What is a process evaluation? It is a quality improvement process, which explores the challenges and success factors of the CHNA activities if it is to be replicated or scaled up. Ultimately, it is intended to draw conclusions on the quality, efficiency, limitations, and scalability of the current CHNA process. Here we have a logic model, which is an overview of everything that my team members and I did over the course of the year to conduct the process evaluation. First off, we started with a knowledge synthesis. We did a literature review using the PRISMA model. Then, from the inputs, we assessed our inputs using human and material resources. We then did qualitative and quantitative activities. Qualitative by doing project team interviews, and quantitative such as reviewing the project records and administrative documents. We then concluded the activities by doing a data analysis, and report write-up. Our outputs were the report write-up of the whole process evaluation. So, what outcomes did we want to come out of this process evaluation? For short term, we wanted the CHNA process to be validated in terms of quality, efficiency, limitations, and scalability. For medium term, we hoped for increased efficiency of data collection, and for the long term, we wanted increased community engagement and service delivery for clients of the Rockcliffe-Smythe neighborhood. So, what is a literature review, and how were the CHNAs evaluated? We conducted a literature review to get a sense of how other CHNAs were evaluated in order to inform our own process evaluation. To do that, we consulted 3 main databases: Ovid, Medline, Embase, and PsycInfo. The main search terms that were used were community health needs assessment and evaluation of process evaluation, or quality or best practice or approach or principles. Using the modified PRISMA model, out of 77 articles, we selected and used 20 for our process evaluation. Here are the literature review results. which brought about 4 common CHNA challenges. The first one was human resource based. We found that personnel were tasked with conducting the CHNA in addition to normal responsibilities. Secondly, it was difficult to acquire sufficient material resources to address the needs identified by the CHNA. Third, there was interinstitutional variability in CHNA planning, implementation, and follow-up. And lastly, there was a need to engage community members and establish community partners for sustainable significant impact. So why is it so important for community engagement to be within a community health needs assessment? 1. Accountability to community and community animators. 2. Accountability on the part of community members for ethical collection of data. 3. Mutual respect. 4. Trust. 5. Co-building. 6. Empowerment through learning. And 7. Inclusiveness.
So the results of our literature review formed the basis of our evaluation framework, which is 5 quality domains through which we look at the data surrounding the community health needs assessment to see if the process was done in the ideal way. So our first quality domain is accessibility. This is asking whether the CHNA process and tools are reaching vulnerable populations in the Rockcliffe-Smythe neighborhood. This brings us to the next one, reach. Was this process able to survey a representative sample of the community? Number 3, effectiveness. How effective are the CHNA activities at gathering sensitive information about the community? 4, efficiency. Were the CHNA activities able to be completed in a timely manner? And last is scalability and sustainability. Is the CHNA process transferable to other agencies and community health centers to use in the long term? So our evaluation framework informed our methodology, and it was the central axis upon which guided our analysis and write-up. Let's talk about our data sources. We had access to the CHNA project team and CHNA project documents. The project team was composed of Access Alliance staff, students, volunteers, the Community Advisory Board members, as well as a new role, community animators. Community animators were normal people who lived in the Rockcliffe-Smythe neighborhood who were recruited to mobilize within their own communities, within the connection and networks they had access to organically, to reach out to people in the community and deliver surveys. In addition to interviewing the CHNA project team, we also took a look at CHNA project documents such as logs and survey metadata. And with these project documents, we took out data and did statistical analysis. The interviews and analysis were passed through the lens of our evaluation framework, which asked our 5 relevant questions. And ultimately, we have an output, which is a Rockcliffe-Smythe CHNA Evaluation Findings Report, which contains recommendations for future CHNAs. And this report will be used to inform future activities at different Access Alliance sites. Let's talk about what we found throughout our process evaluation. First, let's talk about accessibility. So again, this means whether the CHNA activities were able to reach vulnerable populations. One initial concern was that because of the high immigrant proportion in the neighborhood, people would face language barriers trying to deliver these survey tools. A neighborhood profile suggested that there were a high proportion of Portuguese, Spanish, Arabic, and Vietnamese-speaking people within the neighborhood. And for this reason, 4 translations were made in these languages. And we can see that although English is the predominantly used language with over 90% in this pie chart, the other languages except for Arabic, were also employed to a certain extent. And overall, the people who delivered the surveys, administered them, reported that they didn't really encounter any language barriers. So this was an effective means of increasing accessibility. Another thing, though, is that time was a major barrier. Why? Because the survey was a 22-page long survey, which had 43 questions and innumerable sub-questions. While over here you can see that it says this should take about 16 to 20 minutes, in reality, for some people it took over an hour, and for others they had to do it overnight and have the survey administrator return to pick it up. Although this is super long, changing the length of the survey may prove difficult because this is a provincially validated tool to ensure equity and accessibility to represent all the people in the neighborhood. Let's look at another domain, reach. So this is asking, was the survey activities able to reach a representative sample of the community? Over here in this graph, you can see that the age distribution based on the neighborhood profiles. When we compare the neighborhood profile distributions to the distributions of survey respondents for the CHNA, we can see that the youth and senior population is super representative of the actual population in the neighborhood, and there is a high proportion of most respondents were working adults between the ages of 24 and 64. The survey did not survey children, so they were not represented. Another thing, when we look at the gender, based on past neighborhood profiles, we can see that the gender was usually equally distributed. However, this CHNA seems to have a small issue in that females are overrepresented at 66% and males are underrepresented. This is something that could be potentially addressed in the future. Lastly, a thing about reach is partnering with partners. 14 community partner invitations were sent, and a huge number, 9 community partnerships were formed. This is good. This is really important to reaching out to different people at different locations within the community. Let's see where the survey people went out in their community. They went to their buildings, their community centers, their daycare, and even their friends and families. They also went to the food bank and the library. And so overall, multiple measures at different levels were taken to improve the reach of this process. So were these measures effective? Lastly, this brings us to optimizing scalability and sustainability of this approach. We have 3 key success factors. First is the dedicated CHNA coordinator role, which holds everything together. Next, we have the extensive engagement of community partners and community members. Lastly is this new role, the community animator, and this is something which can definitely be replicated at other sites. Our recommendations for future community health needs assessments boil down to 3 areas. First is to abbreviate the survey tool, which would greatly improve accessibility. Also is improving awareness of perhaps a digital survey tool option. And lastly is to create a platform for knowledge mobilization back into the community, to inform the community of CHNA findings and to follow up. So overall, in conclusion, to summarize all these results, we say that the 2019-2020 Rockcliffe-Smythe Neighbourhood CHNA activities, they were methodologically sound, and they were executed to ensure accessibility, to broaden reach, and that it effectively reached the survey response target on time. This concludes our presentation. Thank you so much for listening, and thank you to everyone at Access Alliance and at U of T UTIHI who supported us throughout this process. Thank you.